Thank you very much, Dr. Mitra, distinguished speakers and leaders of immunization in India and everywhere else, given this is a World Congress on adult immunization. I'm going to go perhaps very quickly, and this presentation may not look like a conventional presentation suitable for a World Congress. Some of you may even be surprised, or I hope not offended, but and one of the ways in which it is going to be different is that you'll be hearing music and perhaps other sounds as we go. So first of all, I'd like to say this is very timely. I think there's a small technical glitch, as always happens, of course. This is very timely because Immunization Agenda 2030, so the strategy adopted by all of the member states of the World Health Organization, as you know, places as one of the key strategic priority for life course and integration, with the goal that all people benefit from recommended immunizations throughout the life course, effectively integrated with other essential services. However, the story I'm going to tell you will show that it's not so easy. And in fact, recently I had a chat with someone from the headquarters of the World Health Organization, one of the people responsible at the global level for life course and integration, who said, what can we do to get more interest from professionals who work in immunization in this question? So that is one of the ways, one of the questions that I'll be trying to answer. Now, our work since the 29th of April, so World Immunization Week 2021, has focused on this question, really thinking about the future of immunization. And at least for this decade, it's focused on Immunization Agenda 2030. Now, just if you can easily, if you don't get everything you want from this presentation, if you'd like to know more, just look up the Geneva Learning Foundation or my name, and I welcome, happy to connect with you and encourage you to connect with the foundation. Another thing is, one of the things we're experimenting with, and this is part of our mission to find new ways to learn and lead, is really to, we're now offering a podcast, and I encourage you to go look at that if you'd like to know more about our work. Now, very brief introduction to the foundation's work. We develop a number of programs. It's about transforming how we learn and lead. The basic change in the model is shifting from old learning, where you have a teacher at the center addressing the students, transmitting information to the students, going to a new learning model in which teachers are learners and learners are teachers, connected to each other around this hub and spokes where everyone is connecting with everyone else. Here at the right, you see one of the main theoretical models and frameworks that we rely on from Bill Cope and Mary Colansis, which is really an agenda for new learning and assessment. What that means in practice, for example, in our partnership with the World Health Organization, we've developed already, I think to this day, we're now at the 30th. We're currently running the 30th cohort. The last 4 or 5 cohorts have been specifically on Immunization Agenda 2030. And one course in particular really helped immunization professionals look at this question of life course and integration. Now, with the first evaluation in January 2019, this is what we found. These are more than just courses. These are interventions designed to foster and improve practice at every level. Together with, in fact, Dr. Mitra, other scholars from India and 56 other countries, we then built what we call the Impact Accelerator, a new kind of system to help immunization professionals tackle difficult questions and lead change, including this change from where we are now with vaccination focused primarily on small children to a more complex but also more valuable and more productive immunization system that looks at immunization all along the life course. We found that this system, for example, within 6 months could produce startling results where we saw that people who engaged through this impact accelerator were in fact able to lead change far more quickly, with almost an 8x difference. We're 8 times more likely to actually develop a meaningful, tangible project around their needs, their challenges at the local level, wherever they work, and actually take that project forward. So what we've where we are today is, as of this morning, our platform connects 43,981 immunization professionals. And again, in this decentralized model, it is not only about what we, as the Geneva Learning Foundation, transmit to practitioners. It is also very much about practitioners sharing with each other. On the 29th of April 2021, you can see here the two top global people from UNICEF and WHO respectively, Dr. Robert Nandy and Dr. Anne Lindstrand, who met with over 5,000 immunization professionals in an online event from basically all over the world. And they were there to present Immunization Agenda 2030, but they were also there to listen to the challenges. And I would like to say that life course and integration was cited as one of the top challenges, but it was not. And I think this is one of the many reasons why I see this particular event, the World Congress that you are organizing starting today or kicking off starting today, as a key event, because right now the perspective of life course and integration is not at the top of the agenda. It is very prominent in SP4 of Immunization Agenda 2030, but I believe, my conviction is that it is the movement, the mobilization of professionals like yourselves who will be in the coming weeks, months, and years making the difference, putting this question at the heart of everything that happens in immunization. This question of how we lead change in immunization, for a long time, maybe we did not really need to ask it. Immunization was one of the few interventions in global development that actually worked, where we could line up the kids in the village and they stopped dying stupid deaths from diseases that no one should be affected by, much less die from. Now we have a more complex environment of obviously a changing world, and therefore it is necessary. We feel that there is an imperative to move again, to mobilize again around questions that are new, to advocate for change in respectful, constructive ways. But change is certainly needed. So on the 7th of March, and you can see here the sort of slogan and banner, this call to join the movement for immunization. This is not, kind of just an activist or rabble-rouser movement. This is a movement called for by the Director General of the World Health Organization at the 74th World Assembly, calling for a broad social movement for immunization that will ensure that immunization remains high on global and regional health agendas and help to generate a groundswell of support or social movement for immunization. Now, this movement is larger than any one individual or organization, but I believe an event like this World Congress is positioned and uniquely positioned to contribute to that specific question, a strategic priority of Immunization Agenda 2030, that despite the recognition of science that it is an important question, has not yet been translated into policy practice. That is why we need initiatives like yours in order to help build and propel this movement, and to make sure that all of the questions that matter, all of the questions that can make a difference, can actually just be part of this movement for change, to make sure we can achieve the global goals of Immunization Agenda 2030. What's at stake? The estimate by the World Health Organization is that achieving the goals, including strategic priority 4, life course and integration, will save 50 million lives. That is the estimate from WHO. So again, through this World Congress, you are contributing to a critical question that is part of this broader movement to save lives. Now, at the Geneva Learning Foundation, our contribution, we look at education, we come through the door of education, and we've been working across a number of areas, across medicine and public health, as well as humanitarian response. We've developed an approach called the full learning cycle, and on the 7th of March, our contribution to the movement was to call for immunization professionals to join what we call a full learning cycle. 6,319 professionals responded to this call, and of those, 151 were from India. You can see the list here of all the countries involved. You can see that still many countries have one sole representative. India is number 4 in the ranking. It is not a ranking but it is a reflection of the extent to which there were immunization professionals at that point in time who were already ready to respond to the call. The call is still very much open, even though the movement has now been launched, as we progress through this continuum of action from knowledge to impact. Now, you may ask, what is this full learning cycle? What is it about? What is the curriculum? What is the content? Well, we flipped on its head the logic of content being pushed from Geneva or Washington or London or Seattle to people in countries. And instead, we are asking you the question. You work in immunization every day, whether you are in a health facility, whether you are in a district, a region, or working at the central level with the Ministry of Health. And so we asked you, what are the challenges that matter to you? And every person who applied to join the movement responded to over 95 questions, including the questions to identify their biggest challenges. And again, life course and integration, adult immunization was not in the top reasons. Despite its recognized importance right now, what this gives us is a picture of how much work remains to be done, and therefore how important events and initiatives such as yours are to the recognition of this strategic priority, that this is indeed a strategic priority. Now, in the full learning cycle, we have launched what we call the Ideas Engine. I'm going to very quickly tell you more about that and invite you to go look, see for yourself. And of course, call on you to, if you find this compelling, if you see this as a potentially useful way to strengthen the work that you are doing, to join this movement for Immunization Agenda 2030. The Geneva Learning Foundation will be offering 3 levels of certification for the different components of the full learning cycle, and there is very much a modular approach where every participant decides where, when, and how, and where they want to engage in order to gain the greatest benefit that will help them, that will help you in your daily work. Dr. Godwin Mindra from UNICEF made the point that in this, even though there are people from all levels of the health system, we are at a juncture where the difference is going to be made. The point of contact, where the rubber hits the road, will be where those of you who have direct contact with the communities are going to use new ways to do new things, and that is all about reaching the unreached. Kate O'Brien, the director of immunization at WHO, we need people to feel like they have the authority and are empowered to lead change in their community, in their program, at the most local level, understanding what the goal is and what the targets are. And that means that if someone who is working at one of the so-called lower levels recognizes the significance and importance of adult education, they should be adult vaccination, they should be supported. They should be that initiative, the willingness to integrate adult vaccination into the ongoing program historically focused on children needs to be recognized and supported rather than shunned or seen as something that threatens the existing way that things are done. Now, what does this movement mean in practice and what has it generated? We've seen incredible levels of motivation, excitement, and enthusiasm. And this is from Asad Ali, who is in Pakistan. And even though he is obviously very busy, he takes time to actually let us know. He says, I'm in a mountainous region of Pakistan on the COVID-19 vaccination surveillance and monitoring mission. And he has the kindness to let us know when he will be back. That is how committed he is to contributing to the global movement, even as he continues to do his daily work. And this is from Afghanistan. And Syed writes and says, very simply, only one line. We asked him if he was ready to join and to contribute and to begin the activities of the full learning cycle. And you can see his response here. It is just one line, but it is quite eloquent. From an immunization professional and a doctor, he says, yes, I am ready to rock. Now, what do we actually do in this full learning cycle, and how could this be helpful to you and others who are leading the change needed to have adult immunization recognized and integrated into existing immunization programs in India and elsewhere? First example of the first component, what we started with on March the 7th, was the Ideas Engine. And what this is across these 7 priorities, 7 strategic priorities of Immunization Agenda 2030. You can see there's one here, SP4. This is the one that every one of you can contribute to, and also go and look at the ideas and practices that are being shared from participants across the world. It is as simple as clicking a button, and in the first 10 days of the movement, 764 ideas and practices were submitted from 62 countries. And this came from 671 scholars, practitioners who shared these, including a small but significant number of ideas focused on SP4, on life course and integration. Now, again, the ideas and practices by country, you can see the list here, which countries contributed more. And I'm proud to say and report that India shared 27 ideas and practices, 3.5% of the total. Now, before I go any further, this idea... Yes, and this is a quote from a participant. I encourage you the Ideas Engine is open to all members of the Movement for Immunization Agenda 2030. It is a public good that we offer the structure, but it is being filled by practitioners from all over the world. So if you want to see what is being done, what are the practices, what are the ideas in other parts of the world, that is what is offered through the Ideas Engine. I'd like to mention another initiative that is part of this movement for Immunization Agenda 2030, and that is Teach to Reach. For the first time on the 17th of June, we're going to be opening up Teach to Reach, which historically was a networking event reserved for immunization professionals. And for the first time, professionals from other areas of health are going to be welcome to join. This makes it relevant because life course and integration requires a more integrated approach. We cannot continue to work in silos. And just to give you an indication of the scale on which these networking events, this Teach to Reach happens, the last Teach to Reach on 4th of March saw more than 8,500 immunization professionals from all over the world connect and support and meet and learn together. Now, what's the point? What's the value of this and other activities in the Movement for Immunization Agenda 2030? You can see one quote here. I had the privilege to interact with very highly qualified, internationally recognized health professionals. It's like an opportunity to dine with the creme de la creme of global health. And a second quote from someone who is probably closer to the ground and works in a rural area and who's been wrestling with vaccine hesitancy, and who says, after Teach to Reach Connect, I have evidence to convince any resistant people. This event was amazing to me. Of course, if you work in public health, you're asking, well, okay, what's the impact of this? Where's the evidence that this is actually making a difference? We can spend time talking to each other, connecting with each other, but so what? And so on the so what, we're using an evidence-based scale tracking, not only taking the temperature of what is happening throughout the movement with people, individuals reporting to each other and to us what difference it's making in terms of a gain in confidence. If you're going to go advocate that adult immunization needs to be a focus of your immunization program, you need to have the confidence to do it. If you are going to consider changing how the existing system that is entirely focused on children needs to expand to teenage girls, to adults at different points in the life course. You're going to need motivation, and you can, of course, rely on the ideas of colleagues who are right there, your immediate colleagues, and of course, they're the ones you work with every day. They're very important. But this idea of a global support system, imagine if all of a sudden you can benefit from the inputs, the ideas, the practices of thousands of other fellow immunization professionals from all over the world. That is the power of this approach and the potential of this movement. After participating, I thought I need to find out more technical details about my country's program. So this is someone working in the health facility who all of a sudden, rather than waiting to be told, do this, do that, may go look at the country's program, see that adult immunization is already part of the story, and say, how come we're not doing it? So imagine that kind of local initiative. If all of a sudden people at different different at every level of the health system are speaking to each other, connected to each other. And this is not a dream. This is what we're doing every day in the movement, and this is what we have done since the COVID-19 pandemic came, and we created what we call the COVID-19 Peer Hub. So again, to finish, this is about the need for change and recognizing that leading change in a globalized, hyper-connected world cannot happen in isolation. We simply cannot continue to do things, learn things, and lead change in the ways that we have before. Last but not least, you can see the QR code here. If you'd like to experience this is, again, a testimonial from a participant. Every Monday we have an assembly. You do have to apply to join the movement. It is actually closed, but I'd like to, on an exceptional basis, we'd be honored to have members of the World Congress join us. It is every Monday, so the next one is actually happening tomorrow it is quite late Indian time because it is 5 p.m. Geneva, so I believe that would be 8:30 p.m. Indian Standard Time. Thank you very much. I think I apologize if I have been over time. I hope that Dr. Mitra will forgive me for that.